So no matter where you are on your aesthetic journey, from at-home solutions, skincare, to natural injectables like PRF, NanoFat, even surgical options today, this is a conversation you don't want to miss. Today, I'm joined by Dr. Kian Karimi, world-renowned Beverly Hills facial plastic surgeon, and together we've spent years developing PRF techniques and protocols, advancing how we dissolve fillers safely, and even fixing complications from procedures done around the world. This episode today is a rare behind-the-scenes look at what really works, what doesn't, and how two experts think through the toughest cases. Whether you're a patient, a provider, or you're just simply curious about looking natural in this era of overdone faces, this one will change the way you see aesthetics. Now, before we dive in, make sure to like and subscribe if you like this type of content. It helps you take your personal journey to that next level. It really helps me bring you more knowledge and get more informative guests like we have today. And the best part, it only takes you a second to click like and to click the subscribe button. Because I know many of you have not subscribed and you've watched 2 or more of my videos, but you haven't joined me officially. Much appreciated. Here we go.
And I wanted to do this with you, and I know you want to do this too, because there's been a lot of chatter about PRF, EasyGel, blood platelet therapies, other things that have come out, bioregeneratives, biostimulators. So I just wanted to kind of, break it down with you, because you and I have done a lot of work on this and have really dedicated a big part of our educational careers and focus on this to kind of go through everything. You're in Bangkok right now at the Congress. What is everybody talking about?
Well, I tell you, and you said it well. I mean, I think we've probably been talking about this for 10 years, we at least. And the cool part about we did a bunch of panels yesterday, and the cool part about it is I still feel like it's just getting started. Like there was a doctor from Pakistan yesterday, and they deal with a lot of melasma. So he was presenting cases of PRP and PRF with melasma and how they're using it there. And then just a lot of interest in it. And we can go into many facets of it, but one of them is there's so much stuff on the market that people are asking for the science behind, exosomes, PDRN, PM, where's the data? And I know you've done a lot of work on that maybe we'll touch on, but I think it's only gaining traction as people are using it more and more. It's one of these things that they're finding more and more uses for, and they're more comfortable using it in the practice versus some of the other modalities out there. So it's definitely hugely talked about. Absolutely.
Well, you know what's so interesting is that you and I really started developing EasyPRF. It's almost 10 years anniversary now, if you can believe it. And we developed EasyPRF and kind of, did all the protocols and all the right spins before the filler backlash, before anybody knew how to use Sculptra, before hyperdiluted radius was a thing. And it's so interesting to have it, continue the conversation. And just to give a little background on this, so Anil and I, when we started looking at EasyPRF, we saw this 100% autologous substance. Prior to PRF, I was using PRP. And PRP, if you know, was developed in 1998 by dentists and oral surgeons in terms of how to get more platelets out of blood and utilize the growth factors from platelets for faster wound healing. And then you and I, Anil, really looked at this in terms of how do we do this in the aesthetic world? And so EasyPRF was born. And the most exciting part about EasyPRF, I was using it in surgery, was using it on wounds, but when you injected it into the face, it gelled and became a biofiller. That was really exciting. And for something 100% autologous from your own blood to do that. Can you kind of share with me just how that changed your practice and perspective on what's possible?
Yeah, and I think the interesting part about it is, that was a big stumbling block for us at the beginning is how do you spin it and how do you keep it a liquid, but yet realizing the exact stumbling block we had with it forming a clot and, essentially pulling our hair out, trying to figure that out, and then figure out that was the benefit of the whole product, right? And then now to the point where we're heating some up for the albumin so it hangs in there longer. But I think that for me, and you mentioned PRP, and I like PRP a lot, and I still think there's a lot of good applications, but when we in practice, which is, of course, we had the data from a lot of other facets other than aesthetics. But when we did it in practice, I was able to do under eyes, and that's where I started. And I know you're doing a trial on that, which maybe you'll share in a moment. But the clinical outcomes were just far superior with PRF. And the funny thing about it was there was less additives, so it's not really classified as a drug. And we're also, you mentioned fillers and the move away from fillers. I'm absolutely seeing that here. It's beyond. So, and I think that leaves a vacuum to be filled. And you go to PDRN, you go to exosomes PN, which are all great and promising. But I think having an autologous 100% natural affords a practice a lot of opportunity for, I'll say, legality leeway, and we can have that discussion too, but also a lot of reassurance that we're not creating a drug, we're not adulterating the product, we're not adding sodium citrate or heparin. And much to the chagrin at the beginning, because we dealt with the clot, it's become our best friend.
Yeah, it really has. And, even though, you and I developed PRF, Easy Gel, before that, it's not like this was something brand new that we discovered. I mean, the oral surgeons had been using this in the oral and maxillofacial world, but they were just using it very differently than how we're doing it now. And when I first looked at PRF versus PRP, I mean, if you just type in a meta-analysis of PRF versus PRP, I mean, it's very clear the benefits of PRF. And just to break it down for everybody that's watching this live, so PRF, platelet-rich fibrin, is basically all of your blood platelets, how they exist in your blood, surrounded by their fibrin. There's no anticoagulant like there is in PRP, which makes it 100% natural and autologous. So when you inject PRF or you apply it topically, the platelets release their growth factors slowly, just like they do if you were to suffer a wound, over a week compared to 10 minutes, which is what you get with PRP. For me, that was the most exciting thing. We are replicating your ex vivo, outside of our bodies, what's happening in vivo. And that was so exciting. But what everybody else was really excited about was this whole volumization notion. So I was injecting PRF everywhere. My patients were getting volumization, but it wasn't lasting that long. And so the next challenge was, well, how do we make this last longer? So I started mixing it with stuff. I was putting PRF in everything. I was practically having PRF in my coffee in the mornings. It was like, so I mixed PRF with Radiesse. I mixed PRF with Sculptra. I mixed PRF with HA filler. And that was actually a very important learning curve because, like, for example, with filler, I really caution mixing PRF with filler now in the under eyes, because when you exceed the volume capacity of one of your fat pads, by definition, it's going to go somewhere else. So it can migrate or it can go into the superficial compartments. And so now I really exercise caution. And also for patients that have had filler in the past, in their mid-phase, in their under eye, if you apply something like Sculptra, which is 99% water, or PRF, or Easy Gel, you can actually hydrate that filler, change its properties, and make it more superficial.
Yeah, and I think the next part about the under eyes, is so delicate. And one of the things we're seeing with single growth factor products that are out there now, when side effects occur, the under eye is one of the most delicate areas. And that's where we learn, right, from a lot of different products and fillers that hit the market. We learn their properties, not from the deep medial fat pad injections as much as the under eye. And we're able to learn and use PRF in that area. And I think that tells us, for me, in my practice, how safe it is, how effective it is, because you're treating one of the most delicate areas. And I think one of the things that's worth mentioning too is when we talk about other products that hit the market is, and you can touch on your experience with this, but I find, and we talked about it yesterday here in Bangkok, the reactiveness of certain products. And someone was saying, hey, the inflammatory reaction of a PLLA versus a PDLLA versus cross-link fillers and non-cross-linked and skin boosters. And you don't have that spasm or the reactivity because we're not adulterating the product with another drug. And so it's a pure product. And so I think that's another, when you talk about the under eye, that's a key issue for me. And so many of our patients now have autoimmune. I react to this. I can't take perfumes. I can't use half the skincare that's out there, but PRF lends itself to that. So the under eye is really telling for us. And I mean, in my experience and people that reach out to me, under eye side effects are very rare, and usually you can tune it back to too superficial with a gel injected versus the product issue.
Yeah, I want to talk about under eyes a lot because I think that's probably, at least here in the United States, one of the most utilized areas for
Mhm.
EDRF and Easy Gel. But I want to get back to your point on the reactivity of things that are natural versus things that are not. So if you go to the conferences, they'll say, well, there's been cases of blindness from PRP, and mechanistically, the only way I believe that's possible is with one of the additives or with the Buffy coat coming into it. And I say this, boldly, and every time I say this, I always waiting for thunder to strike me. But so far, in almost 10 years, there's never been a case of necrosis, blindness, stroke, or any other serious complications from 100% pure PRF or Easy Gel. And so that really speaks to the fact that when something's injected into a blood vessel, into an artery, even if it is a clot, as long as it doesn't have a spasmodic component where the body doesn't spasm against it, then it is less likely to lead to one of these devastating complications. So, in terms of a safety profile, I think that speaks to a lot on this. As medical director, I get asked all the time, what are the contraindications to EasyGel? Who cannot get EasyGel or PRF? I mean, the answer is pretty much no one because it is your own blood. Now, there's some conversation that to be had about the quality of your platelets and whether
Mhm.
people have good quality platelets or bad quality platelets. But if you're in ill health or if you're a cancer, on chemotherapy or have had something else affect your body, then utilizing your own body and cells, I think makes the most sense rather than testing your immune system, which might be compromised or in a hyperactive state with something else. And so I think that's an important point. Let's talk about under eyes. So I'm at congresses all the time like you are, and I'm hearing more and more ophthalmologists and oculoplastic surgeons caution against injecting under eyes. And the companies, they're not talking about under eye filler anymore. They were all excited these companies, when they release a product, that's 2 or 3 years later. It's like a book chapter. By the time a book chapter comes out, half of it is outdated. And so,
Yeah.
real current conversation is important. Now, in the under eyes, the reason why the under eyes is so critical is because we have a ligament here. We have a ligament here, and it's hard to blend that transition. And then we have lymphatic flow coming from the outside of our under eyes, both superficially and deep. And so when you put something here that partially or fully blocks the lymphatics, that's what can lead to or worsen malar edema, so bags and under the eyes, festoons, and a very unnatural appearance. And I think that's where the backlash of all this filler comes from. Now, personally, Anil, I think that under eye fillers can be really great if done
Mhm.
properly. But it's
Mhm.
really hard to do it properly. What does properly mean? 0.2 ml on bone, needle or
Yeah.
cannula, and
Yeah.
and and I personally I taught people how to inject under eyes the wrong way for nearly 10 years. Okay, I'm embarrassed to say this, and if you were trained by me for your under eyes with a cannula, I am so sorry because I taught you to come laterally. I taught you to bring your cannula this way and inject retrograde. But now that I've had ultrasound and I've fact checked myself and I've seen my own results, when you come from here medially, your cannula is going to be superficial. And that's the problem. And so now will come perpendicular, and the same thing with Easy Gel, perpendicular to lay it on the bone. It's really easy to get too superficial here. And as soon as any product is in the orbicularis muscle, that muscle around your eye, which is right under your skin, the muscle will grab onto it and it stays there. And that's the issue that we're seeing. And the capacity of the under eye is very low. And so less is more in the under eye for sure.
Yeah. I'd say two things. The first one, I always poll the audience as well about the problems with PRF, blindness, nodules, and everything. Because these congresses, it's genuine information. I want to know. And I poll every lecture I did. And I was in a big congress in Korea 2, 3 weeks ago. And then here. And I'm like you, I'm like, God, don't even say it. But I mean, no one in the audience has seen blindness from pure PRF or gel. Now, there are a few cases in the literature, and what no one talks about is a few of them were unlicensed clinics that weren't even people who had licenses. And I would submit to you that they added silicon or something else in there, which is often the case because it's cheap and people get good results initially, but complications later. And the other thing is a lot of those cases, the handful that are out there, they admit they mixed it with filler, cross-link filler. So I agree. And a dermatologist posted online the other day 3 things that he wouldn't do. And one of them was, oh my gosh, I would never do PRF because you can't reverse it. And I think to myself, that's like saying I'm scared of being an alcoholic, but I never have a drink in my life and I never will. Like it just didn't happen. So how does it happen? You know what I mean? Like, so the FUD that's out there, it's tough, and people put that out, and of course that gets a lot of views and likes. Social media is that way. And the other one that bothers me a lot is people say, you alluded to it, the age. So people's blood product isn't good after 40 or 50. Well, I'm no spring chicken, but I heal up. When I cut myself, I heal pretty good. I'm hurting myself all the time, unintentionally, of course. Sports and everything. Albeit it's a little slower to heal, but everything feels pretty good. So my point is, it was all about wound healing and inflammation. And I would also submit and remind people that we have demonstrated now growth factors in the spins of EasyPRF, and also now exosomes in the spins. And I think the mechanism of action we fully don't really understand as much as we can say we understand it all. But when I heard about the pigment cases and the reversal of pigment and the inflammation in the basement membrane that these guys were talking about in the conference yesterday, I understand we only know the tip of the iceberg. And that's why we get so many different elements that are treated. So when we treat the under eyes, I agree, small amount of filler. And the last point is people would say, well, I did true PRF and I don't see a result. It didn't work, right? But then you put in 0.1 or 0.2 of filler and their under eye looks gorgeous. And I would submit that it wouldn't have looked that way if you didn't make the fat pads better. And if you're 60, you need a few treatments of something. You can't come in and expect to, have a facelift with one injection session if you haven't done it and taken care of the under eye area. So there's all kinds of that FUD out there, and it drives me a little crazy. But yeah, a lot of it isn't true.
One of the things I really want to emphasize is science, evidence, and data. And that's why I love PRF, because even though PRF has only been in the US for 10 years, it's been used worldwide far more than that. And there are hundreds of studies on people, on humans, on PRF. You can go to PubMed, you can go to Open Evidence, which is a free, it's AI that looks at all peer-reviewed publications, and you can ask it about PRF. And the data is so important on wound healing. I use it in rhinoplasty. I use it in fat grafting, use it in facelifts. But in the face, and this is why it's been so exciting to work with you, because you and I really have pioneered in terms of how do we use PRF and EasyGel in aesthetics, particularly as a biofiller. So I want to give a little background on EasyGel. So EasyGel is basically, it is autologous, it's still 100% natural, but we basically found that when you heat part of your blood, it makes your most abundant protein in your blood, albumin, human-centered albumin, start to unfold. And so when it unfolds, it quadruples its surface area, and it's an irreversible unfolding. So now you have this scaffolding that acts as a matrix, and then the PRF that you also spin without heating it, mix it with that scaffolding, and that is what EasyGel is, and how EasyGel was born. And EasyGel now, and I'd love to hear your experience. EasyGel we've been using everywhere, but my favorite areas to use are in the under eyes as a standalone procedure. I'll use it in lips for patients that don't want volumization, but they want revitalization of their lips. And I'm also using it when we have to reverse fillers and then immediately replenish with EasyGel, which I have to credit Nurse Amy Lynn for coining the art of reversal, where it is a true art. Because in LA here, and I have all these patients come, they trust me, their lips are overdone, their eyes are overdone, but they would rather be overdone than look hollow, because they understand from their friends that the fillers that have been there for a long time have acted as tissue expanders. And so when you, and, I mean, we've all experienced this that are providers. You try to do a good deed, like let's dissolve your under eyes. Come back and see me in 2 weeks. When you get the phone call that night, the next day, what have you done to me? I'm hideous. Oh my God, I look like a skeleton. I wish I would have just gone away because they already had the perception drift. They forgot what they look like, and then you dehydrated them, and so that's why that's where Easy Gel really comes into play as a natural bioregenerative to replenish the tissues so that you don't get that dehydrated appearance.
Yeah, I love that you say that too, because you get that. And of course, there's whole, forms of people talking about the dissolving and dissolving, getting rid of your fat pads. And I think for me, using, recombinant technology for the, again, a Hylenex type of hyaluron. I think there's so many, and being over here in Asia now, you see so many different ones. I haven't had a problem dissolving. Sure, 3-4 days, you said it. Dehydration, maybe a little natural hyaluronic acid goes, but it replenishes. But PRF truly is the reverser of that. One of the things Amy Lynn's been working on, and that I've been talking about a little bit too, is kind of the baby face. That I actually presented that, but really what it means is just what you're talking about. And the difference in the perception over here that I see in Asia in a lot of parts are that they're okay. Like we went into a clinic the other day and they did, they cleanse and they do the microblading, all this kind of stuff. And then they're getting HIFU, they're getting RF microneedling, and then they're getting their blood products and even nanofat. And they're like, Rosanna, you want your treatment? And they're doing all that. And now I go, how long does that take? An hour and a half. Like they're stacking all the things that would normally cost us 20 grand. But the point is, the people that are getting that perception that when all the filler's gone, when you add back the PRF, I think we need to accept that we're not going to blow the face back up and that that's okay. And it's one of what I love being over here is that people accept that you're going to come in every month, probably at my age for the rest of my life. I need something every month if I want to maintain it, right? So it's not like we have to revolumize the whole face and blow. But if we take care of the fat pads, which I really believe as I do more of this, that we're making the fat pads in the face, and the anatomy much better than I do in the under eye. The fat pads, sometimes you can't even see them. Sometimes they're non-existent on dissection. So to make that better in one session of PRF is very hard, but I think it truly makes, and that's why I think full face PRF and subtle changes becoming accepted. We're seeing the acceptance of PRF and the acceptance that you get improvement in the skin over time, but not this big gigantic result. But I'm so stoked that that's the trend, honestly.
I want to talk about some studies because you initially were the one that kind of taught me in terms of like having to repeat PRF, doing 2 to 3 sessions, because I was thinking like the filler mindset. Let's inject it like a filler. Let's see how long it lasts. But you were just
you're in LA and I was up in Portland, so my patients lended exactly to that. They want it all natural, and they don't want all that. So we had the different demographics, which is pretty cool. I'm like, Dr. K, what are you talking about? You're like, well, they're not walking out looking with the high cheek. I go, isn't that so good? Yeah. So that's why I worked.
We decided to study. So we published a study in Facial Plastic Surgery and Aesthetic Medicine. We did a prospective study of Easy Gel in the nasolabial folds. And in the study, we used 3D volumetric photography to actually track and measure the volume changes that we saw. So the way the study was designed, the patients couldn't have had any filler ever in the past. We injected the Easy Gel into the nasolabial folds and we looked at them prospectively. We treated them 3 times, 1 month apart. And then we measured them a month later, 2 months later, 6 months later. And the results of the study, first of all, the first thing we look at is safety. There were no adverse events related to the PRF study. And so that's always great. The second thing we were looking at is efficacy. How well does it work? So the vast majority of patients, I think 90% or so of patients, were very pleased with the results of the volumetric changes that they saw in the nasolabial folds. Volumetrically, we actually saw on average a 1.3 ml change at the end of the study, 6 months after their injection. We even had a couple of patients that had lasted 8 months. Now, when I say lasted, it's kind of like talking about neuromodulators. It's not like the same volume that was injected was a change. three-dimensionally. But even a 0.3 ml change in a sensitive area, the under eye can only take 0.2 to 0.4 ml max. And so I'm super excited about the under eye study because if we can affect a 0.2 ml change in the under eye lasting 3 months, 4 months, then that is truly a game changer. And so that's what and right now we're involved in a prospective multi-center trial looking at EasyGel specifically for the under eyes, and the early results have been really exciting.
Yeah, and I appreciate you doing all that work on that because I mean that we, as much as we know it happens, you have to have the science and data to back that up. And it take people probably don't understand what goes into doing a study like that. I was talking to some U.S. doctors yesterday, and that you got to be set up in your clinic to do that, and it takes a lot. There's a lot of effort, and it's why a lot of companies don't do the work. And one of the things we talked about on the panels here in Bangkok yesterday was the fact that these products are coming out and single growth factors are coming out, and they're like, why is everything coming to the market with no data? And then say, we'll get a data in 3 to 5, 7 years. And you and I know they'll probably never get FDA approval. What are really drugs, honestly, because they're synthetic. Okay.
Yeah.
And so they're not going to get FDA approval. And what's going to happen is the side effects pile up. I mean, it's a very delicate, the fact that the data and the science behind PRF, and then with what you're doing in aesthetics for the data, that's going to amount, and the fact that there is no drug added to it, it really is, I think, the perfect combination of treatments. Now, somebody asked, I just copied a couple of questions that came through, but they asked what the cost is for under eye PRF. Could we talk? Is that okay to pivot first? We can always come back to stuff, but I think interspersing some practical stuff for people might be fun. So do you want to touch base? I know you did a ton of training through the US recently too. I saw some pictures. What would an average clinic charge for PRF under eye?
I think an average clinic would probably charge around $1,000 for under eye PRF, sometimes a little bit less. So PRF and EasyGel, when you spin it, you get about 5 cc's, which you never put 5 cc's under the eyes. So typically full face EasyGel, we charge about $2,500 for that. If you're just breaking out for PRF for the under eye, then I think PRF per vial is somewhere between like $500 to $750. So it's a really accessible price point. I mean, it's still a lot of money, but for something that, compared to a filler, if I put a filler under your eyes, it's $1,500 because I have to pay $400 myself for that product. And so, but then the question is, how long does it last? How many times do they have to repeat it? So then I tell patients, like, look, for your under eyes, if you can give me coming every 3 months and I do EasyGel under your eyes and you're paying $1,000, you're going to still end up paying less than if we were to do something else in that area. And so I do think it makes a lot of sense for that patient looking for the 100% natural bioregenerative biofiller. It really is phenomenal because it's not just volume. You alluded to this. We see improvements in skin texture. We see improvement in hyperpigmentation and in melasma. And we don't fully understand as to why. And we don't have gene expression data like Sculpture does because we're not $1 billion company to look.
And it took them 25, 30 years.
Yeah, it took them 25 years to be able to fund gene expression data. I would love to do gene expression data on PRF and EasyGel.
It would be off the charts. It would be amazing if you got it, because I guarantee the gene expression would be very positive.
Yeah. I would actually take this question I just saw. Does EasyGel or PRF interfere with the facelift? Because there's a lot of talk about biostimulators, threads. So I can tell you with 100% certainty that EasyGel and EasyPRF will never interfere with your facelift. Now, that being said, if you've just had EasyGel injections under your eyes, you probably don't want to get a blepharoplasty 2 weeks later because your surgeon may not be able to accurately assess. But from all the oculoplastic surgeons that I've spoken with, I was just having a conversation with one of these yesterday. He's like, you know why I love EasyGel? Is that when I go into the under eyes, the tissues look healthier. It's not like filler. It's not like even former fat grafting. Even prior fat grafting causes some scar tissue in that area. And so it will certainly not interfere with the face.
I want 1 minute just to talk about spins, tubes, and spinners. Whenever it fits into our discussion.
Yeah, knockoffs now.
So like a lot of countries here, they can't get the spinners or the tubes, right? Like people are restricted and they're saying, hey, what spinner? understand when people say, hey, I had 4PRF, it didn't work. One of the things I get hit back on social media all the time, and I'm able to talk to people and go, what did you have done? What did they do? Oh, they had this spinner, that tube. Did you look and see that it was Easy Gel or Easy PRF? No, they had some other system. Where when you spin, and I showed this at LAMCA, we had a great lecture on this last year, and I think we're going to do it again this year, and I'll show this. Different spinners with the same tube gives you an absolutely different aliquot, and horizontal spinners, and so I won't go into all the details, but the horizontal spinners spin like this, and you have spinners that are on different angles. Even if the table's shaking, even if people draw the blood and they wait 5 minutes to get it to the spinner, microclots, you're not going to get the same aliquot with exosomes and growth factors. So it's not all created equal. You can't just go to your lab and grab a tube, put a spinner, hold it up and say, that looks good, I'll inject it in the face. A studied system is important. So a lot of people don't realize that. They just, oh, you spin the blood, you'll get whatever. Yeah. So I don't know if we see that or you haven't been.
And you and I did so much work on this initially, just looking at all the different factors in terms of spin times. And, so we had the oral and maxillofacial literature to go off on IPRF or injectable PRF, but to really make it, positively suitable for aesthetics, and to make sure that we were getting the platelets. I mean, the whole thing with PRP is that most of it has nothing. It's platelet poor plasma. It's PPP. And so with PRF, you're really just spinning out the red blood cells. So all that yellow supernatant, and actually the closer you are to the red blood cells, the concentration of the PRF actually is a little bit higher, closer to that. But it's really exciting stuff. And, I look at other things and I hear companies claim that, like PRF doesn't have that many growth factors, ours has more. But then when I look at the risk benefit ratio of injecting someone autologous materials, and especially in a high profile practice such as mine, I would never risk doing something that is off the shelf for profit, for ease of use, or if there's a slight increase in efficacy, which I'm not convinced that there is, it's simply not worth it to me.
And the 300,000 claim, 300,000 times more XYZ growth factor, or we got, 5 billion exosomes. Who in the world says 300,000 times is better? In fact, 10 billion exosomes is the right number. Nobody knows. But does it sound good? 12 billion? I'll take 12 billion. But it sounds good, right? But it's not money. So all those narratives are things that we could talk about for 4 or 5 hours. But just for people out there, don't be fooled, because if you get 3 to 4 times or 5 times your growth factors, stem cells, or exosomes autologously from yourself, that's probably pretty darn good. And do you really want 5,000 times, 300,000 times? It's crazy where companies come up with that number and they think it becomes a selling point. It perpetuates itself.
So I think what we should do, I can't believe we went on for 40 minutes already. Wow, I thought this was going to, would have been done. I want to take some questions now. Do you want to maybe field some questions, or I don't know if you've been looking, Anil, I'm not very good at this.
Yeah, I copied down a couple that came by. I'm always afraid to touch these things. There you go. I'm scrolling through some, but the money question was the one, and we talked about that. We talked a little bit about the lips. I will say, someone asked about the lips. I am always surprised at vertical lip lines. Like way back when we started doing it, I'm like, why not put a strip of PRF in the upper lip for lip lines? Why not? Right? It won't do anything. And lo and behold, I've been able to follow patients over 1 year, 2 year, and you see I'm sure it's the fat pads. I don't know. Also the dermal, probably improving the dermis and the thickness of the dermis, but vertical lip lines improve, without a lot of times aggressive lasers. Obviously adding lasers, Tatafiller, different things can help. But so someone asked about lips and understanding the interesting thing here, studying faces too. What makes a face attractive? Sometimes darker hair, thicker brows, more red lips, a little color to the face, right? Why do women put makeup on or red blush? All those things, I think, with growth factor stem cells, there's 1% stem cells in your peripheral blood. We concentrate that. That all adds to the overall look of whatever we want to call it, the baby face, the subtle face. But color makes someone look attractive. So when you talk about lips during the ovulation cycle of a female, the lips turn red for fertility for a reason, and they lose color over time. So all the subtle things of beauty we want to talk about, PRF and autologous helps with that. But that was one question. Here, you answer this one.
Yeah, I'm going to answer all the questions about safety, because I'm seeing questions about histamine response. I'm seeing questions about nodules. I'm seeing questions about complications. So again, I'm the medical director for EasyGel and PRF, so I get every complication that's reported in the country. So I can tell you that the most common complication with EasyGel or EasyPRF is swelling. And the swelling can last for a week or even longer. And the most common reason for that is overinjection of the product or injecting too superficially. So they bring their cannula, like how I used to teach them. I probably taught them wrong. And injecting along the orbicularis muscle. So the muscle, even though it's PRF or EasyGel, is still swollen for a couple of weeks. The third is nodules. Now, if a patient has never had fillers or under their eyes, then there's really no way to create a long-standing nodule. Mechanistically, it's impossible. However, a lot of patients have had fillers. We all now know that fillers sometimes are there forever. And so when you rehydrate that filler or move it off the bone, changes rheological properties, that filler can get deposited superficially and leave, like, the sausage, the tyndall, the malar bag. Then you've got to go in with your dissolver, with your hyaluronidase or Vitrace or whatever you're using, wherever you are in the world, and dissolve that. And so those are the kind of like watch outs with EasyGel and EasyPRF. Some patients do have a very robust histamine response. I saw a couple of questions about that. If they have a known history for that, you treat them with an antihistamine before the procedure, and even with a day or two of prednisone, 10 milligrams, 20 milligrams, etc. And so that is really.
What would they see with that, Dr. K? Are they seeing redness? Are they like what can you describe what the practitioner would see that would differentiate a histamine response?
Easy swollen reaction under their eyes. That's a histamine response. And so some people get histamine response from anything, slap their face and they get a histamine response. And so an antihistamine before the procedure and 1 or 2 days afterwards, I think is helpful in those patients that that, or they report it to you. You put them on antihistamine, you can put them on some prednisone, and that will calm it down very, very quickly. Please compare PRP gel and PRF gel. I'm not sure what PRP gel is, because PRP gel means there's a lot of additives added to it to make it a gel, because PRP by definition is anticoagulated. So I can just tell you, without knowing what PRP gel is from wherever you're asking from, that that PRF gel is going to be your 100% autologous, no additives added. It's allowing your platelets to clot once they're injected in your tissues.
They might be referencing an Egypt study. There's a study in Egypt where they took PRP because it's a fast spin. So it's pretty much nothing in there in terms of exomes, growth factors in PRP. So it is albumin, which is what we heat up. And in Egypt, it was PRP. They made it into a gel. They inject it under and around the eyes. And they looked at 3 months and the gel was still there with no decrease. They didn't go out to 5 to 6 months or beyond, unfortunately, but it demonstrated, it's a nice little study. It demonstrated that the gel hangs in there for 3 months and looks the same as it did in week 1, which was good volumetric changes. But there are people that just heat up PRP, and that might be what they're referring to. But again, now you've got a product that has something in it, which is heparin or sodium citrate, likely.
Yeah. The other point is that some people say, well, I injected PRF, I injected EasyGel, it didn't last. The question is, how are you measuring the changes of the tissue? How are you measuring the changes of the skin? And PRF and EasyGel is not meant to give you big cheekbones, projected chins. It's not a filler. It's not an implant. It is a bioregenerative, autologous material. And just like when I talk about Sculptra or other biostimulators, I say, if you want to use a biostimulator, you have to have the bio to stim. We all have to become kind of functional medicine doctors here. We want to have our patients have the highest quality of platelets and the highest quality of their blood products. Sometimes you'll draw blood, spin it for PRF, and it looks like fat on the supernatant because the patient's triglycerides are so high, or they have a really high diet in inflammatory foods. And that is our opportunity to talk to our patients, be like, hey, let's talk about your lifestyle. Let's talk about, what you're eating, what you're doing, your habits. And so it's not a magic wand. You have to be invested in your own health and aesthetics. And this is where health, wellness, and aesthetics cross over. At LAMCA this year, we're going to talk a lot about that.
Very cool. Very cool. And we're going to do some EasyGel and stuff. and are you having a section on that? We, what you might consider, we might have a social media section. I don't know if you thought about that, but my plug is that we need to, as providers, doctors, nurses, PAs, whatever you are, a healthcare provider, estheticians, seeing patients, get on social media, because we all have the knowledge and the expertise, and patients want real information. It's up to us to really use social media to stamp out all of the, what would you call it? The FUD, the fear, uncertainty, doubt, and the infactual information out there.
If we didn't get to your questions, it's because we're not trying not to answer them. There's just only so much time in the day to do all this stuff. With that, I'm going to wrap it up. Anil, thank you so much for joining us from Bangkok, Thailand. Really grateful for all of your guys' engagement. This is how we get better, how we progress the field. And we'll see you all soon.
Thank you very much, Dr. Keon, for taking the time too.